I think I have the longest title, so if you have your title down for the CEU credits. You have to get all the capitalization of it. We're going to be talking about maximizing your potential with your CMMS. So we're going to talk about 6 things to evaluate if you're looking at a CMMS for your facility. I assume most of you are using a CMMS. Just if you're not, if you're in here just for other reasons, I'll briefly describe what a CMMS is. My name is Joe Stockman. I'm the Director of Product Experience here at, well, not here, at FSI. It's a software company that makes a CMMS. I've also worked previously for Four Rivers. They make a CMMS product for teletracking. They do, way back when they were just doing phone stuff, but the reason their name was teletracking. I have over 30 years just doing CMMS work for healthcare specifically. I did go to Penn State. And I went for electrical engineering, almost a biomed tech, way back in the 90s. So I almost became a BET way back in the day. And when I was at Four Rivers, actually, the BET professor there donated a the med tester 5000 to us to build that first interface that we did at Four Rivers. So lots of experience with CMMSs in general and in biomed testing. So. Our software is created specifically for healthcare. We focus on the healthcare market. We're based out of Pittsburgh, PA. So are those other companies. Pittsburgh, PA is like the CMMS hotbed for healthcare CMMSs, I guess. We do both facilities and clinical engineering and PBS. We service all hospital operations, basically. We have about a 99% retention rate. We started out just doing data collections. We actually go around the facility doing data collections. There's a picture of some of our data collectors. One of the guys here does. We actually have all of our new employees that are required to go on data collection when you start for a company, just to get an idea of what's in a hospital and the cadence around how people do their work. So, just a brief list of some of the products we offer. I'm not going to go through this. We have some quotes from some of our customers buying that, but I don't want to get into that. I'm going to get into sort of the meat of the whole thing. Somebody had a transition to this slide, so I apologize for this, but if anyone recognizes any of the logos up here, raise a hand. I know we're in Indiana, but we do have quite a few biomed customers or HTM customers but we're going to start. What is a CMMS? A CMMS, basically, the second stands for Computerized Maintenance Management System, term coined in the 1960s. It's designed to help you. It's a tool. It's supposed to help you manage your work orders, your preventive maintenance, your assets, all aspects of what you're doing and documenting. When you're looking at common requirements, some of these you'll see later as we talk about our ROI. It's a work order management system, inspection, testing, and maintenance. Newer term that people are using to replace PMs, PM preventive maintenance. You're doing more than just PMing something. You're inspecting it, you're testing it to make sure it works, and maintaining it. So you might see the term ITMs appear here a couple of different times. And some of these are requirements that are in manufacturing, if you're in different industries, healthcare specific. You have the big thing of compliance is the one that we're going to focus a lot on as well. Some issues with currently in CMMS world is insights into your data. That's a big issue. You see lots of stuff with AI and different data points and all those things. We're going to be talking about those as we go to the AI as well. Then we're going to go right into some of the ways to evaluate your return on investment. So, first, asset management. It's one of the key things of a CMMS. It's something you have to have. I did say that I sold out of the previous ones. So I put Captain Obvious here. That's the obvious ROI that we're going to be talking about first. But the other ones that we're going to be talking about are compliance. What do you need in your CMMS to show that you're compliant? The financial aspects. How are you tracking your financial aspects of all your equipment? Including who's maintaining that equipment, your vendors, contractors coming in. How do you track all that information? Data insights, just with Power BI and the new tools out there, how are you getting the information you need? Interoperability, the software we're going to talk about MedTester interface 30 years ago. What are we doing today to interrupt, to integrate with other types of software and efficiency? It's a tool. It's not, your job is not to use the CMMS. Your job is to perform work, keep the equipment safe, make sure those patients are safe. That's your main job. That's what you do. We're a tool to help you do that. If it's hindering you, you don't want to use that. So first, asset management. We're going to talk about the core of how I got into the industry. Really was doing those physical inventories, walking those hundreds of thousands of square feet of hospital space, looking for that stuff, and then work orders and ITMs. Those are your PMs as we go through. So I put together the slide of the asset inventory life cycle, and it starts. And I put the word easy. The getting asset inventory is easy. You go around, you put labels on things, you walk around, and then 10 minutes later, it might be inaccurate already. That's the hard part. So the initial, when you do it, you're done. You walk around your facility. Like I said, you're tagging the stuff. You're scheduling it. You know, day one, week one, month one of your CMMS implementation. You have a pretty good system. Then things go haywire. So as you're scheduling the IBMs, they come out, you go ahead and perform them, and then you're looking at them. Sometimes you can't find that equipment, so in a corner somewhere, it's stolen, whatever the reason might be for not being able to perform that ITM. You're looking at those. If you have older equipment, you're looking at that and saying, hey, it seems like I'm constantly fixing the same things with these. How are you documenting that? How are you evaluating when you need to repair it or replace it? As far as whether it's part of your ITM or part of your service request. If a piece of equipment keeps breaking down, how are you tracking that? How are you documenting that? And then how are you verifying that everything's still there? How are you adding new stuff as it comes in? So it's a constant cycle of maintaining that inventory. The main, so you're never completely satisfied. It's never done. So never think you're just done with that part of it. Some people do. Some people say, hey, got all my inventory, and now it's this machine that's running. That's not the case. Maybe in a manufacturing environment, that's the case. There's little maintenance, but in a hospital, there's things coming in and out. Even things from other hospitals. I had one hospital, competing hospitals in the city, call and say, hey, somehow we have one of your pieces of equipment in our hospital. They got, it's bad enough when you're a hospital system. If somebody goes to the North Hospital to the South Hospital with the ambulance or something, you could track that. How does it end up at another hospital altogether? That was an interesting one for me. So as you do your inventory, without an accurate inventory, what do you do? How are you, you're not compliant. If you don't have a document of everything you're doing, you're really not compliant. And then where is it? We have a little representation of our asset inventory on a floor plan. If you do have fixed equipment, easy to find on a floor plan. If you have mobile equipment, you do need some type of other system in order to find that equipment on the floor plan, such as an RTLS, which we'll talk about a little bit later in the interoperability section. So how do you maintain that? How are you able to just do that on a regular basis? You can't go do an inventory every 6 months, or you can't just take the time and walk your facility and make sure everything's there. So something you could do is look for the capabilities of adding feedback with your technicians. And they're the ones that are out there. Some of you might be those technicians. So you're out there in the field, you're adding the equipment, or you're not finding the equipment. Is it here? Am I finding it? Yes or no? If the answer is yes, obviously you fix it or do what you need to do, look at the condition of it. If it's in bad condition, how do you let somebody know that? How do you document that? And then how do you modify the asset to show those things? As part of the PM process, you're used to just doing testing, fixing it. There's no way to say. Some people put in the comments, this equipment needs replaced, but how many people go through all the comments in your CMMS and look at those? Not too many, I assume. So what can you do to do that? We're going to work with some customers to actually add a feedback loop into the PM. So with every PM or every ITM that goes out, they have these questions that, are there any defects that can be followed up? Sometimes you make it do that to fail to like safety test, it'll generate a corrected work order. The other one is the procedure correct. Does the procedure need updated? Are you doing any a procedure for the wrong manufacturer on this equipment. Did somebody patch the correct procedure? Again, if somebody sees that and says, hey, this isn't the right procedure in the comments, as an administrator, they're not going to see that. But if you say, oh, wait, it is wrong, you click no, you answer that, you say, hey, the documentation is wrong, it can tell that person to go ahead and fix that, the right procedure, go find the right procedure. Maybe you're getting newer equipment in, you're passing the older procedure, a new process as part of that new equipment. So again, having that feedback with your technicians is an important part. Same thing with scheduling. Is it scheduled properly? You know, when that new equipment is coming in, did somebody schedule it? You know, sometimes things come in, sometimes people just start putting them into service. Hopefully you're not doing that. Hopefully you're doing the tests and everything that you need to do prior to putting that into service. Are you attaching the correct procedures? So again, when you're looking for something in the CMMS, look for something that helps you find those. You know, you can't go through every piece of equipment. You know, you have tens of thousands of pieces of equipment in your hospital. You can't just go line by line and say, this one's scheduled correctly, this one's scheduled correctly. Again, use that tool to find those things. So when you find, you know, with this section down here, if we have procedures required for that piece of equipment, we can just search for assets that are missing those procedures. And then we can go ahead and schedule those. When I open the asset, it says there's a button here to add missing procedures, and it tells me which procedure I need to have on that particular piece of equipment. So look for the tool, and I'm showing you examples from ours. If you're using another tool, you know, look for those things, ask for those things from those vendors as well. It's important. Again, it's designed to make you guys do the important work. You know, let the CMMS vendor do the hard work of making it easy for you to do that work. So, part of the analysis, parts of those, if you look for analysis, a lot of these intertwine. It's sort of a piece of a pie. We're trying to find the right graphic to show how everything sort of intertwines with each other. Each one's not its own individual pillar for ROI, but can you look at different types of equipment by category? You know, make sure you do have them categorized in a way so you can look them as a group. Some people make descriptions different than others. But, you know, how are they scheduled? You can see here, this with some of our analytics, this particular argon gas liquid surgical unit, all of them aren't scheduled properly in this particular example here. So again, use your analytics to find those things out. So that's going to stop you from missing those PMs. Without things break, you know, there's a lot of your time managing your IPM and making sure you're compliant, looking for those underloaded equipment, but you have a process in place for when things break. When a nurse has a broken infusion pump, how is that nurse sending that to you in your department? Are they putting in a web request? Are they calling you? Are they asking people to just put a note on it broken and stick it in the corner? And part of the process is the biomed that comes up there a couple times a day and looks for broken equipment in that one particular corner. Your facilities folks might not like that because you're not supposed to keep things in a corridor. That might be how you're doing it. But what is your process? And can they put that, you have to spend the time to put that asset number on there. Let them put that as part of the request, make it required. So they can't even submit that work order, submit that request, not putting an asset number on it. So you have that documentation. If they just put this thing broken, you fix it, send it back up, you have the work order, but you never attach the asset to that work order. You can make it required on your side too. You don't have that history. And that history of that equipment, how many times it's broken, is important. So those are some things you want to do. So just a quick summary. You know, when you get lots of equipment during COVID, getting lots and lots of new equipment to help you know, with the surge of patients. Is there an easy way to import those things into the system? Is there an easy way to edit those things? They change, the priority needs to change, your department needs to change. Can I go ahead and edit those? Can I schedule all those quickly? How can I go ahead and perform those operations? How do I make sure all the procedures are compliant? I'm using the right procedures on that equipment. How am I handling my service requests? And again, data insights, it's its own pillar as well, but as part of asset management, looking at the big picture is a big part of that. All right, the second biggest one, the reason we all have to document our work, but obviously if you want those reimbursements, you do need to show that you're compliant. So that's the second one we're going to talk about. We'll get the two big ones out of the way first on these ones. So with compliance, there's a big thing around standards. What are you doing with standards? Are you doing the right schedules? Are you doing the right inspections? Are you doing them at the right time? Are you doing AEM inspections, OEM inspections, alternative equipment maintenance for those of you that are in the original equipment manufacturer's recommendation for AEM versus OEM? We'll talk about some of those things as well. And I have this slide here. Maybe you people in the room don't get to choose who your accreditation agency is, but somebody can. There's a couple big ones out there. The Joint Commission started in 1951. HFAP started in 1965. They've since, I think, rebranded as ACHC. And then DNV, I was surprised when I looked at this one. It didn't even start until 2008. So I thought it was a little bit, at least for healthcare accreditation. So that's when they started. There's a newer one too, CIHQ, that is out there for those as well. So I do have a question. I just want to see the answers. How many are Joint Commission? Then I'm going to ask it a different way, just so I don't go through each. How many are not Joint Commission? And are you DNV if you're not Joint Commission? Okay, so, yeah. Those seem to be the two big ones. I've yet to find somebody raise their hand at CIHQ. That's my goal of doing these talks. I actually went to the CIHQ conference last year, and even people there weren't. They're like, "No, I'm like, why are you here?" It doesn't make sense. But they don't go. Say that again. They don't go. They're accreditation agencies, so they have to meet specific requirements. It all starts with CMS. So CMS certifies them, but it's not our product's policy. Don't use everybody, but CMS, the Center for Medicare and Medicaid Services, which would be really confusing, would be CMMS. Really the industry for a loop. But they let people come in and do their inspections. When they come and do your inspections, sometimes CMS does their own inspection, sometimes just the Joint Commission will show up. A lot of times now they're coming together. And CMS is sort of making sure everyone's doing their proper due diligence in some of these things. With the things. I think there's been a lot of turnover because of COVID and different things. There's a lot of new Joint Commission inspectors out there as well. A lot of ones that are ready to retire. But you also have other authorities having jurisdiction. AHJ is the term. But I went and found, I just looked at a couple with Joint Commission, DNV, CIHQ, and if you're a healthcare a larger healthcare organization that's acquiring on systems, what happens if you're a Joint Commission hospital and you acquire somebody that is a DNV hospital? Are they going to switch? We actually have customers that are both. They use both DNV and Joint Commission, depending on which hospital they're doing. Some are trying it out, like, hey, I hear DNV is nicer. Is that true to DNV people? Is DNV nicer? They're there every year. They're there every year. They're there every year. They keep you at a consistent output. We don't have that. Yeah, 3 year, like, hey, everything's perfect, and then everything's crap, and everything's perfect again. So it's a little, but they also say they work with you to do that. It's Joint Commission inspectors. I talked to folks, and they're there to help you. Obviously, if you're running a really bad hospital, they're going to hit you hard, but they want their patients to be safe too. That's the whole goal of all this stuff. And the one person told me is, these are the minimum requirements you need for a safe hospital. You should be doing more than this. This is like the bare minimum you need to have a safe hospital environment. But there's other things beyond that you can do. There's many things people are doing to do those things. But each of those sections is specific to medical equipment. There's also things about medical dispensing and imaging. Some of them have specific imaging ones. I think DNV has, or CIHQ or DNV, I forget which one, has specific medical imaging items as well. But the point of that is if you're doing the procedures and you have a procedure for this equipment, can you show that you're compliant with both DNV and Joint Commission? Or if somebody says, hey, let's try CIHQ, can you show compliance in all of those items without changing your processes? You shouldn't have to change what you do. maybe a free, it's all based on CMS. You're doing the same things, it's just a different language. So how do you tie those together? So, just this example here, I have Joint Commission ECO 2043, 4. I look it up. I'm not a code geek. Don't ask me code stuff. I have 3 that I remember. So, and I only remember 2 of them right now. So don't test me on that. But the testing and maintenance of all sterilizers, and then if I have procedures that tie to those, I tie them to that particular code environment. I can have the same code for DMV, for CIQ, and use those same 2 procedures to tie to all those. And that way, when I do my compliance reporting, I'm just doing that sterilizer scope annual or sterilizer quarterly inspection, and I'm able to show compliance in all systems. Also, if you have state requirements, if you're in a certain state that has different restrictions or different frequencies, you can make sure you're doing those things properly in those states as well. On the facility side, they do have that a lot. On the biomed side, I'm not sure if states follow stricter, more strict restrictions or testing on certain items. I found cities with fire have tighter fire code requirements. So Chicago and Florida, city. I'm from Florida, but there's more requirements around frequencies and some of those things to make sure they're tested properly. But there's a reason hospitals don't burn down. Someone said, it's my favorite quote ever, it's hospitals are designed to burn the people inside them. That's a great quote, and it's true. You can't evacuate everybody out of the hospital in fire. It's time to get them out of the area with the fire, and that part's going to burn and get put out, but it's designed that way. But so that equipment you got to move and manage out of there. If you tie all that together, tie your procedures to your assets, to your compliance, you could get insights into the data. We have this compliance dashboard. I pulled up, this is a Joint Commission one, most important Joint Commission, sorry for that example. But ECO 20403, EP4, I could look across my year. I have 2023 in here. I can see how I'm doing with my compliance. I have this lighted up here, so if some things are failing, if I can track my unable to perform assets, whether it's on patient or whether it's I'm unable to locate that item, I can track those as well. But this gives me an insight into how I'm doing, making sure I'm compliant for the year. It's a way to check that on a regular basis. Am I compliant? And I check those things regularly. So look for those types of tools as well with your healthcare specific CMMS. And again, when you have that documentation, where are you keeping it? Is it all in paper binder? Printing it out? How many people are still printing it out and putting it in binder? You're different than my facility. I love it. That's my goal at the beginning when I started some of this stuff. Is have it all electronically somewhere. But where is that? Is it on and can you put it in the document management system that we can get it to it from anywhere? Is it on one of your local drives? A lot of people are using SharePoint, print out those, document those, have those ready for their inspection. I keep hearing Joint Commission inspectors want paper. That's not true. I think some prefer it, but if you don't have it, you can print this or if you want. It's here, it's all right here. So. But find a place to store all that stuff. And try to find one place. That's my recommendation. Don't have it in different places. Whatever system you're using, find one place to keep it all. That way you're like, oh, that happens over here. Or that the vendor gave it to me, so it's in my email, and I can go to my email vendor. When the vendor sends it to you, have a process of making that vendor documentation for you. Don't use that as an excuse. Make it as easy as possible to do your document review with the inspector. So. If you do have a document manager, make sure you can find the equipment quickly. I say practice looking for those things. So if you're looking for something, we can tag them with certain attributes like compliance report. We can tag them with location types of information. It's like I said, we're Pittsburgh-based, so the best towers are fictitious hospital that we have in our demo environment. And then which EP does that particularly cover? So when you're looking for those particular items that make your documentation, make it easy for yourself to find those. That's an important part of document review. So however you're doing your compliance, making so you don't have to be running those reports live in front of your inspector. That's an important part of just showing your compliance. And this report, we actually built this in conjunction with the inspector. It shows you the number of devices that were tested in that particular time frame, the procedure that you did to go ahead and do those items, who performed those, if there were failures, what was done to correct those failures, all those things. So make sure everything links together. You're able to show those things. They want to see failures. They don't want to see 100%. Everything's perfect all the time. They'll know you're lying if that's the case. We've had customers say, like, hey, we want to make all our dots green all the time. Oh, they're not. Some things fail. It's great. And you fix them. And that's the point of it. If you want to make sure you're showing them. Yes, sir.
So, just hearing that, like that point. So you're saying when you got that surveyor coming, you actually, hey, here's our compliance report, here's what we're doing. And that kind of forces that discussion also then. We're not even going to even take what you're if you're able at that time.
Yeah, you're showing them the compliance report. You're trying to not go into the live system. You have to go into the live system, you know your system and know where to find that stuff. But know where in the compliance report it is. And we put this total assets count right at the top. We can be trying to hide it all the time. You know, in certain, the older days, you didn't want to show that things didn't work right. But they don't, and they realize that. So, pointing out those failures, I think even through the report, there is a failure. You can make a text red, so it shows the failures. It's easy to just find, go on through the document, and look for those items. So when you're looking for CMMS to track compliance, again, one of the main things that are different with the hospital industry, healthcare industry versus other industries is making sure you can link your assets, procedures, whatever, to those standards, whatever those standards are, whether you're Joint Commission, BMD, someday CIT, someday understand and make sure it covers them all. Make sure it covers not just the national ones. You have local ones, make sure it covers those too. Understand which work orders are compliance related. Most of them are tracking your high-risk equipment, and that's mostly what you do. So your industry is most of your work orders are compliance related versus facility department where they get most of them are. So if you really know which ones you are, that allows you to make sure you're focusing on those. When we talk about data insights, you can look at some of those things in your work order system as well. Track progress throughout the month. How are you doing this month? Don't wait until the end of the month and go, oh, we're only 10% complete this month. Track it throughout the month, making sure you have the tools to go ahead and do that. And then through the year, making sure that, hey, May's done, you pass May, we're in June, but can somebody go back into May and inadvertently reactivate something, or if there was a follow-up item from May, but not locate item where you have to locate that in June, or you have to go back to that one and mark that as it is no longer here, or what do you have to do there? So again, you're not just looking at last month, you're looking at this month, you're looking at the big picture, because they're going to look at the big picture when they come to inspect. So make sure you have any capabilities of doing that. If you're able to do AEM, alternative equipment maintenance, make sure you understand when you're allowed to, when you're not allowed to. Certain equipment you have to follow OEM, so just make sure you're aware of which ones those are. And then again, try to find store all your documents in one place, like I said, including vendor reports. So make sure you have a common place to do all of things. All right, next one, we go to the financial aspect. It's worth to go. I'll tell you. As I said, we're going to knock the big ones off first. So with financial, we do want to track some things. Capital planning. How do you plan for your future? Part of what you do if you're in charge of the department, you're responsible for when, what funds you need for next year, for 5 years down the road, in order to plan for replacing some of that equipment if it's no longer useful. How are you tracking cost analysis? How much does it cost you to run your department? And biomed is one of the, at least from the customers we work with, something that gets outsourced a lot. Anyone here working for an outsourcing company, like a GE Health or someone coming into a hospital and doing the machines. Yeah, so it's one of the more common on one hand, but it's more common than outsourcing from other facilities. You have these companies that come in, and if you can't show that, hey, here's what I'm spending, they come in and say, hey, we can do it for this. It's more or less than that. Sorry. But it's an important that they might be, you might be spending too much money because you're not doing it efficiently. That might be the case as well. So if somebody can come in and say, I can do it for half that cost, your hospital CFO is probably going to be like, okay, let's do that. That makes more sense financially. But how are you able to show that and what you're spending, including on labor costs, material costs, vendor costs, contracts, all kinds of different aspects of those financial aspects. So one of the main things with tracking for the equipment is the equipment life. What's the lifespan of a particular item? So I have an item pulled up here. Just shows we made the numbers so it's kind of at its end of its life now, but what the replacement cost is going to be, when it's out of service, when it's under contract. But you do want to track that financial information. So you can look at the big picture and everything that's going to be past its useful life, or everything in this category we have, and there's new technology required. Some things you just get outdated with the technology. The useful life might be longer than you might want to keep it because there's just better stuff out there. You want to maintain, you're a world-renowned hospital. You want to maintain that image, so you're going to get the latest and greatest things maybe 2 or 3 years down the road versus 10 years down the road. And there's ways you can get rid of that equipment. You can donate some of that equipment to third parties. There's some really good charities out there that take outdated equipment and refurbish it, use them in other areas too. So just an idea if you're looking at what to do with that, it could be a good tax write-off for the CFO as well. So. But does your software have a capital planning tool? Are you using just exporting stuff to Excel and just doing totals and seeing what those things are? Do you have that financial data in your CMMS? Can you build a capital plan? We have an example here of a 2024 capital plan. What we're going to be spending. We have a budget of about 10 million. How much of that is equipment replacement? How much of it is adding new equipment? We need to add new items to the list. So do you have an overall view of that? But the key to that, the key to building that is sort of how do you get to that information? How do you know what needs replaced? So when you look at what you have for building an analysis, we just took, typically what people are doing is they have their CMMS and then they have their capital planning tool under looking. They sit in a room and go, okay, what needs replaced? And they talk about it, come up with items. But we did is if you're tracking at end of life date, we put the tab in there, literally just shows you all the assets nearing your expiration date. So if you're doing a budget for 2026, it's going to show everything that's going to be near expiration of 2026. If there are things that are out of date in 2027, 2027, 28, they're not going to show up until you're building that capital plan. So you're able to see, hey, what's nearing its end of useful life. If you're doing condition assessments on that equipment, maybe it's part of your PM, but for that example earlier, part of PM, what's condition? Hey, this thing is breaking regularly. You can make that part of PM or IPM process to update that on a regular basis. So again, you're not having to just go around and look for equipment that's bad. It's part of your normal cycle, keeping that information up to date, keeping those replacement costs up to date, keeping all that stuff up to date so you know, hey, these new ones are going on price, so let's update all our costs, so structural capital plan, those things are going to change. We have another tab here for high repair assets. Those high repair assets, a little red light blew up. But the high repair assets are the equipment that you're spending a lot of time doing repair work, non-IPM and non-PM work. So again, looking at some of these examples, we went extreme in our examples, but this one safety analyzer here, 81 corrective work orders in the time period, 3-year period. That's a lot of corrective work. But again, it shows if you bought a lemon, or you have 2 or 3 pieces of equipment that aren't working up to speed. They're under contract with contractors who come back and fix them or whatever. That might be a need to have them replace it or say, hey, why don't you give us this equipment? Why don't you give us a new one or whatever? I can't do it every day. It keeps breaking. Some people make it hard to do. And then each asset. Can you go into each asset and look at the detailed analysis? So looking at the scanner, I can look at my range from 2020 to 2024, what my cumulative maintenance costs are, how I'm tracking labor versus materials. Do I have an accurate labor rate in there for my employees so I can track that cost? Am I just looking at hours versus cost versus money? And then what categories of work am I doing on those as well? Again, your basic 2 categories are IPM, break fix, service request, corrective, whatever you want to call them. Non-IPM is encompassing for a lot of those items. but how are you tracking that? We could actually look at the unscheduled maintenance, the scheduled maintenance, or the total. We're just looking at the unscheduled tab right here. But again, can you look at that information on the tabs? Can you roll that up? And that's what you're going to use to make decisions with the higher levels of those. But again, use your technician, the boots on the ground, if you will, or the sneakers on the ground. A lot of people, I see a lot of yoga sneakers these days. But yeah, walking around a hospital, you definitely want to be comfortable. But getting that information regularly is the key. Or do you have the tool to update the information on a regular basis? Not every month, things like that, but if you're touching your equipment every 6 months or every year, it's not unreasonable to do a quick condition assessment of that piece of equipment and making sure that's update, rather than waiting 5 years and everything just says new. After when you got it, you set the condition to new and nobody updated it. Make that part of your process. Update that as you go. Labor tracking. We have some pieces of analysis here. This here is a sort of, is there a quick way for somebody to enter their labor? Can you track it when they start that? Is there a start stop mechanism? If you're using a mobile software that they can go ahead and say, hey, I'm going to get this piece of equipment. I had to walk up here, I had to bring it out to the shop, I had to fix it. You account for all that time that it takes to do that. If you're a larger hospital, you are going to have those travel times, and that's a big part of it. So that's part of your labor analysis. You include me, I include that. This is my recommendation. I include that as part of my labor analysis. Some people actually they put a time card for travel and a time card for fixed wrench time versus travel time. A little tricky to get everyone to do this, I'll say. A lot of customers just struggle with trying to get time. This analysis tool just says, hey, by trade or by whatever, how many average hours a day are they tracking? We're getting 4.4 hours right now. A lot of our customers drive for 6.5. That seems to be a reasonable amount. Some people want to account for the break time and all that stuff, make sure you have your 8 hours. Look for something, use your own that's for an 8-hour shift. So you're doing 12-hour shifts, 6 hours probably isn't enough. And then you can track down to the person who's doing that, how they're using the software too. So, are you tracking labor? Are you tracking materials? Materials are one of the biggest cost factors in fixing this equipment. So how are you adding those parts to your work? Is it easy to just charge a part? Are you just going to a big warehouse and just go grab what you need out of the warehouse, wire, whatever? You have to order those parts. You have to request those parts. You have an integration, which we'll talk about as well, to a third party where they're doing it, Boston system or another system. Are you just ordering everything from a part source type of system, and then you're tracking those costs right through your work orders, which are linked to the assets, which again, all ties back together. So making sure everything ties back together, especially on that correct report, you want to make sure the data tie back to the asset. Contract. I think I spelled that right. We have a contract and a contacts module, or something pretty DR. But are you tracking work that's under contract? A lot of software out there does track work under contract. You store your contract, you mark what assets are under contract. What we did in ours is, if you're doing work on equipment that's under contract, we actually don't let you do that work until you acknowledge that you know that it's under contract. So you get a little message here that tells you what the contract is, what it covers, and financially, if somebody goes in and tries to fix that piece of equipment that's under contract, what typically happens is one of your people go in and your an MRI machine is under contract, and you go and open it up and start fixing it. Typically, you're voiding your warranty, you're voiding your contract. That's a huge financial impact. So you really want to make sure you have the tools in place to prevent that. They might not know. They're hiring new people. Turnover is a big issue right now in every industry, let alone healthcare. But are you preventing them from potentially voiding a contract by doing work on that contract? That could be, it doesn't have to be more than a service contract. And even if you're not voiding that service contract, that technician spending 4 hours trying to fix something that you could have called the vendor, that's their job. You just wasted 4 hours. So again, trying to prevent that. It's all financial aspect around those contracts. And then knowing what you're paying for, knowing what the assets are covered, how much those contracts are. It's all part of your financial statement. So just to summarize financial, Do you have some type of capital planning with analysis? Are you tracking the cost of the assets and downtime? If the equipment is available, if an MRI machine is down, that means you can't charge for using an MRI machine. So are you losing, not only spending money to fix it, but are you losing money because you can't use it? So that's another aspect that you need to consider as well. Labor and material costs, those are probably the two biggest costs in fixing this stuff. And then contracted services, which is really just paying out to do the labor material. So they all tie together. And then tracking that equipment money, so that's some good insight to know when to replace that and when to buy new. So data insights, I have a couple examples of things you might just be looking for into your data that I think are important. You hear things like dashboards, what kind of analytics do you have, what kind of reports can I run. Just make sure whatever you need to show, you can do from your CMMS. Most of them do these. We have one called daily dashboard. Daily dashboard is sort of what I consider. You come in the morning, what do I need to do today? A dashboard of what daily dashboard is. What's my important work? What's my, from at the end of the month, the drive priority ones that you've done? Is there a needed by date that needs to be found by? Are there things that I couldn't locate? I have to do one last task to go ahead and look for those equipment? What are those things? So make sure you can put those things on a dashboard that you can give to your technician. Your technicians are the ones that they're going to come in. You don't have to tell them you're going to do something. They can go to the dashboard and do it. They can go right into the dashboard and see what they need to do. You can get a big picture as an administrator and see how you're doing compliance-wise. If your CEO logs into your CMMS, but can you make a dashboard for them so they can see the bigger picture? Maybe in a 20 hospital system, you have a different dashboard for somebody that's over the whole system versus somebody that's working in that one hospital. Different ways you can go about and configure the dashboard. Most of our examples are for one big hospital for yourself. Customer satisfaction, something that gets overlooked a lot. When you perform surveys, you get to go, this is part of it. If you look through the code requirements, that's part of it. Your satisfaction, basic satisfaction, part of your survey, your score, and potentially reimbursement. So how are they responding? Your customers are typically not patients, but ultimately they serve the patient. So if something's broken and needs fixed, or you're going into a patient room, your demeanor, your attitude, did you greet the patient, did you let the patient know what you're doing? Those are all things that could come back to impact that score, and again, impact reimbursement. So are you tracking, do you have a mechanism to send out those surveys with the work order, with the, not on the PMs obviously, but on the break fix type work orders or the repair work orders? Can you have a survey of those? You can look at different trades, different work orders, different down to the technician level who was assigned to that, did that work. If you have one technician who's performing that surveys, it's something you can use as a manager unless you're that in the room that gets that survey. But you can go ahead and use that as a management tool to correct that as well. So important aspect of it, like I said, often gets overlooked. So just make sure your CMMS does have some type of capability that overlooks that. Looking at your backlog. Your backlog is just work you had to do. A backlog is good. A healthy backlog is something you want to have. Obviously, this does not look like a healthy one. It's a lot of work orders, but can you take your work orders, look at the average amount of time to complete those things, and come up with a certain number of days where no new work came in? You're able to keep your people working. We know that doesn't happen. Work's always in, I think, unless you're lucky. But how is that backlog growing? Our systems is a demo system, so you can see ours just keeps growing. We keep creating work, but we don't complete it in the system. So our backlog is growing. We can look at that over time. Right now it's at 4,000 work orders. Last period it was at 3,000 work orders, and that's today and then 1 month ago what our backlog was. Can you change those things? We'll get it today versus a year ago, or today versus 6 months ago. It's your backlog. Basically, you want to get your backlogs growing, shrinking, have some cycle to it. Eliminate PMs from that. Typically, PM backlog, it jumps, it's down, it comes down. So how are you looking at that backlog when doing those things. So, time to complete a work order. How long does it take you from the time the work order gets put in, maybe non-PM work order, typically generate those at the beginning of the month or a local month to complete them. So for completing a work order, it's a non-PM work order. What's your average time to go and complete that or respond to it? I think for the response time, you track both of those. You're responding to it, maybe that's for priority one work order, get to respond within a half hour. Can you track that? For non-priority work orders, maybe you have a day or 2 days. It's your own hospital, what you set or what you told you that you're not setting, but it's told you. One of those things. And then completion time. You're responding in a certain amount of time, but what's your average time to complete? It's taking you more than a week to complete a work order. Maybe you have some efficiencies that you need to look at and then get that down to. If your goal is 3 days, you track, am I getting towards that goal? Am I getting towards it? What you meant? Again, if you're setting the goals for your department, again, you go above them and you have to fix it, but you have to fix it in a month. Yeah, that's fine. Then again, you're doing bare minimum or you're trying to excel at what you're doing. And again, show this to your, these are things you can show to your management and say, hey, look what we're trying to do. We see these things. Our goals are to get better at these things. Some people have no idea how long it takes to hire you're going by what you're convinced. Oh yeah, I got the work order, fixed it. But the work's been sitting there for a week. They just get it today. So I fixed it today. Well, not really. We fixed it in a week. So, let the data tell you how you're doing. Don't go in and totally right. Schedule compliance, I sort of showed one example earlier of some things that were compliant. But again, looking at, how many assets you have, how many don't have a schedule, how many are missing procedures altogether, how many have mismatched procedures. Some of those colors tell me that some have the wrong procedure on it, some might have some procedures, but not all of them. Do you have ways to look at those things? And again, can you look at that just at your hospital, can you look at across the 20 hospital system and see all those things? So, like I said, you can't go through 114,000 assets line. You did all day. Even if you had the help, you couldn't do that. IT and reliability. This is the work you're doing. How much, again, how many have a schedule, don't have a schedule, looking at those things at a particular, you can look at that across hospitals. If you had multiple hospitals, you can see them there as well. But again, where are my problem areas that I need to go ahead and schedule? Because I just got a whole bunch of those in and just haven't had a chance to schedule that. So how can I go ahead and look at what I need to schedule? Can I filter that out so if there's things I don't have to schedule for? Can I exclude those from my list? I'm tracking as an asset that I don't necessarily have to do PMs on them. Again, that's probably more on the facility side than the finance side for those particular examples. Can you standardize? We have different modalities or trades. Depending on how big you are, you might put all these in. If you're if you're a 3-person biomed shop, you're probably wearing many hats. So can you do these things with specific imaging, groups that can help? Again, if they're a larger hospital system, you might get down to specialties in these items, or you might not have areas of specialties in these items. So can you, what might you need to outsource because you don't have the expertise of these? Again, if you're setting these things, if you're using these trades on the equipment or the modalities on the equipment, can you build these out and again use them to analyze how many of this equipment do I have? What is the average PM, estimated time on PM? Do I need to hire a resource? When in my next hire, what skills do they need to have? I'm going to bring them in if I'm lacking these skills. So there's a lot here, but if you just, at the most part, you probably have people that are have multiple talents in these items. Some you're probably looking up all the time too. Right? There's how many different types of equipment do you have in your hospital? And does everyone know how to fix every one of them? I was doing it a lot, and nobody knows how to do all this. Maybe somebody that's been there a long time, if they've been there 150 years, they might know how to fix all of them, and they've seen it all. But for the most part, they're probably looking up some things, coming up with things, looking at videos, and some of the newer technologies out there that help you along with it. But again, tracking those items. Same thing with companies. Companies get acquired. So, particularly in biomed, you have something like has this name on it, but you go to look for, documentation on it, and bam, it doesn't exist anymore because they were bought out by GE or Baxter or another company. So are you tracking that information? So you'll say, hey, now this is the new, how do I update who the contact is for the website? You look up that information. Sometimes they're there. When they first acquired, both exist, but eventually they all work together. You might have a lot of broken links in there. So again, as you're going through and changing those items and looking, hopefully the procedures are changing, it's the same equipment, but just where to find that information, where to get parts, all those things changes. So are you keeping that up to date? And so it's in sync with wherever you're getting your parts from, those items. So all that stuff leads you into, like I said, the data insights items. Can you do a daily dashboard? What do I need to do right now? My assets compliant? Am I able to show that some of the earlier examples of the client dashboard and the compliance section is a big part of data insights, looking at the big picture. What do I need to do to get compliant? How bad is it? How good is it? If you're a third-party service, or you get to show those reports to your customers. To say, hey, look how we're doing with those items. Looking at the costs, obviously the cost is a big factor. Can I get insights into those costs? Customer satisfaction, tracking standards, and again, looking at those from your CEO down to your technician level. Who's your audience for those particular items as well? A couple minutes left. Luckily, I don't have too much in the interoperability slide, but you're using other software too. You're using other pieces of equipment. You have a material system. You might have Lawson, Workday, PeopleSoft Part Source you're using. So how are you getting information between those systems? You're using testing equipment, whether it's Fluke or Prompt or DataTrend or another one that you're using those. You're using the Med Tester 5000C. Do you have an interface for that? Your RTLS system, or you have a system in place to find that equipment that's moving around. It's real-time locator software. Can you find that movable piece of equipment? Timekeeping software, whether it's Chronos or you're using Chronos. I could think of that. But they're the main one out there that's specific to that. Other ones out there with software as well. Security, devices, can people hack into your devices? How are you tracking that? Some companies out there like a similarly mitigated scenario, so you can have integrations to those items. And then single sign-on, that's probably the most common one. Can you just log into your software without having to log into your software? You log into your computer, log in once, you're good to go. And then does the CMMS support? They might not have all these. I'll say you don't have all these. That's not what this is. But can we, if we have, give them an API that's public facing, that we can build to that to show those things. So look at those items to see how you can go and integrate with those items. Finally, we're going to talk about efficiency. Efficiency, basically how do you save time? One of those items, do you have a mobile solution? If somebody has to push a cart around, with a computer on it, that might take longer than somebody to use their phone to do those types of things. So what types of mobile capabilities are you looking for to get your work done? Can you look at floor plans? If I have floor plans, I can find that room quicker than I need to get to. Can I look at those items? Can I see where those items are, especially if you have an ROI system? Also, is there easy ways to answer those questions? We have a procedure here. Can I just click a pass button? They're hard to see on the screen, but it's a pass and complete button. It's a one-touch pass. You can go ahead and pass that item. If you fail, there's a little more work you can do to go ahead and fail that item. Can I add labor materials mobilely? That's an important aspect as well. Can you automate that reporting if you're running those compliance reports and storing it somewhere? We have a product here that can automate that and run those for you. So as long as everything works in order, that compliance dashboard's all green, maybe the 3rd or 5th of the month, that report runs automatically to the document manager. Can you use other tools if you're remote? A lot of people are remote now, at least at the management level. Can they assist you if you need to go in a room with a product and let you go and look at virtual reality to use other data? Is that part of it as well? So again, looking at efficiencies, mobile solutions are the things like auto sign, dispatching for work comes in, does it get to the right person? You have to have a human person. Time tell it where that hardware goes and the system goes to do that. Oops, sorry, one more.